So my main area of research is in economic evaluation. Now, I have a very passionate belief in the fact that we should have well-funded, publicly financed healthcare systems. But those systems are really coming under pressure from the increasing amount of high-cost new technologies that are becoming available. Now, economic evaluation gives us a tool to assist decision makers to try and make those very difficult decisions about which technologies they should cover within the healthcare system and which we can't afford, don't represent good enough value for money, so therefore would be wasting those scarce resources that we could be applying to other healthcare that would increase the overall health of our population. Now, I've been involved in a number of studies in this area over my long career, and so I've been teaching as well in health economics for over 20 years and doing studies for almost 25 years. So I've gained a lot of expertise in this area, but I've also benefited a lot from my interaction with decision makers and realizing the studies that we need to do have to be relevant to the decision maker, because there's no point developing an excellent economic evaluation that is technically sound but doesn't address the needs of the decision maker. So one of the more recent studies that I've been involved with was with colleagues in Brunel and across Europe was the EQUIP study, which was a study that tried to look at the return on investment for tobacco programs in different European Union countries. And so it really had huge stakeholder involvement. We really understood the needs of those commissioners who would have to make decisions about which public health interventions should be used in tobacco cessation, and we really benefited from that because it really improved our research. Other research I'm doing at the moment is more typical economic evaluation, looking at new technologies that there need to be a case for whether or not we should be funding these. So clinical areas I'm working in right now include osteoporosis, obesity, which is really timely given the problems we've got about the changing weights and distribution across our populations, and also doing a lot of work with the Heart Institute in terms of cardiac interventions. So recently I've been involved in Canada in developing guidelines for economic evaluation, probably the most recent and up-to-date versions of these guidelines across the world that are really decision focused. They're really recognizing economics as a decision science, with the main focus of studies being the idea that decision makers have problems and they need these problems to be solved, and the tool that we're providing should be addressing those problems specifically. I'm also interested in niche populations, so I've been doing a lot of work recently in the area of rare disease. Rare disease is often seen as neglected states or orphan diseases, and with those it's becoming increasingly difficult to do high quality studies to demonstrate the value of technologies and interventions in those areas. So I work very closely with people with expertise in clinical trial management, biostatisticians, psychometricians who can tell us more about quality of life of patients, deal with people who work in the area of systematic reviews, as well, of course, working with clinical colleagues who often come with the specific questions and problems that need some answers to, and then we work as a team to try and provide the research and the evidence that will help facilitate a decision. So in terms of collaboration, I'm always interested in meeting new methodologists who might have new angles or new methodological issues that they might wish to be addressed. I like to deal with the stakeholders directly. I like talking to the clinicians. I like talking to those working in industry who have specific problems that they need to have some guidance and some work in terms of helping them with their studies. Teaching is a way to be a better researcher. Students keep you on your toes. They make sure that you have to be on top of your discipline, because these days they'll often learn more about the subject before you start lecturing than what you're going to teach them, and therefore you need to know everything that you might be asked by these students, so they challenge you. So I like talking to them about their research ideas at any stage of their career, and I'm also always looking for people who want to have undergraduate or postgraduate supervision in my area, because without students, there's no real point having a university.